Okay, what's up, you guys? Welcome back. I know it took me a little bit long to release this video and record this video and read this dang textbook, but for good reason, you guys. I do also teach and I am helping people pursue the certification, so forgive me, but I'm going to get better at releasing these videos. But without further ado, let's get started. So today we're going to be reading chapter 2, which is medical terminology for sterile processing technicians. And like I like to tell my students, and now I'm telling you, the first thing that you want to do is read the learning objectives. And if you can, when I read these learning objectives, write them down, and I want you to answer the questions after we are finished, because that will allow you to understand whether or not you gain the information necessary from this chapter. So let's get started, okay? All right, learning objective number 1. Explain the importance of medical terminology for sterile processing technicians. Number 2, identify the various elements used in medical terminology, including prefixes, roots, and suffixes. 3, discuss how medical terminology can refer to human anatomy, disease processes, surgical instruments, and surgical procedures. 4, understand medical terminology used in reference to surgical procedures in surgery schedules. And then number 5, understand the importance of medical terminology for service quality in the operating room. All right, so those are the learning objectives for chapter 2, okay? Write them down and answer the questions after I am done reading the text. Okay, so introduction. Sterile processing technicians require knowledge of medical terms to help them succeed on the job. Medical terminology is the language of medical professionals that allow healthcare workers to communicate more effectively. This special terminology is used to describe body parts, diseases, instruments, and surgical procedures. What is the importance of medical terminology? So, the Association of Perioperative Registered Nurses, or AORN, specifically states that skilled and competent allied healthcare providers and support personnel are valued members of the perioperative care team, contributing to safe patient care and positive patient outcomes. As such, sterile processing technicians must have a grasp of medical terminology used by healthcare customers and fellow sterile processing professionals. The American National Standards Institute, or ANSI, and the Association for the Advancement of Medical Instrumentation, aka AAMI, ANSI/AAMI ST79 2017 with 2020 amendments, Comprehensive Guide to Sterilization and Sterility Assurance in Healthcare Facilities, specifically states that sterile processing technicians must be knowledgeable and competent to adequately perform their vital task. The Joint Commission, or TJC, states that in order to maintain a reliable system for medical device processing, institutions must place an emphasis upon the orientation, training, and competency of healthcare workers who are responsible for this task. Understanding medical terminology is part of the training and competency that sterile processing technicians should possess. Now, understanding the operating room. Sterile processing technicians must provide the operating room personnel with instruments and supplies needed for surgical procedures. These needs are conveyed. Sterile processing technicians must also understand the terminology/language spoken to them in order to provide quality customer service and contribute to the positive patient outcomes. For example, if the OR calls for instrumentation needed for an emergency pericardial window, a knowledgeable sterile processing technician will know that this is a cardiac or heart procedure that involves cutting into the pericardium, a membranous sac that surrounds the heart, in order to drain fluid from the pericardial space into the pleural or chest cavity. Also, if the OR calls for a case card for a stat repair of the abdominal aortic aneurysm, or a AAA, this request will be responded to immediately, because the sterile processing technician will understand that the patient is at risk for losing their life. So it is especially important to understand medical terminology because it is the language of the operating room and it is how requests are conveyed. And if you know what type of medical procedure is being performed, you can better assist the operating room. If you don't understand when they're asking for certain cardio instrumentation, or if they're asking for a hysterectomy or whatever, if you don't understand those simple medical terms, then you cannot understand what is being requested of you, and then that'll cause patient care delays, or it could lead to the death of a patient. So it is especially important. Our job is especially important. Now, what does STAT mean? STAT is an abbreviation for the Latin term statum, meaning immediately or at once. Now, providing quality service to the patient, it is through knowing and understanding medical terminology that sterile processing technicians are able to understand what is being asked of them. This knowledge of medical terminology enables the sterile processing technician to react appropriately when the OR or other medical staff makes a request. However, the opposite is also true. If the operating room makes a request that is not understood, the productivity of the OR may be compromised. This interruption of the perioperative process can compromise the quality of service rendered to the patient and may cause a delay in treatment. Now, what is the anatomy of a medical term? Sterile processing technicians frequently encounter specialized medical terms in their daily task work activities, and each of those terms contain key elements to help staff better understand the word's origin and meaning. As sterile processing technicians learn the meanings of these names, they will have a greater understanding of what their work entails. The majority of medical terms are either Greek or Latin origin. The word pericardium, for example, is composed of two Greek word elements, peri, meaning around, and cardia, meaning heart. The term refers to the membranous sac that surrounds the heart, as well as the roots of the great vessel of the heart. The term rigor mortis is composed of two Latin word elements, rigor, which means stiffness, and mortis, which means death. The term refers to the stiffening of the body that occurs after death. Many terms combine both Greek and Latin word elements to form a single medical term. So, for example, the term claustrophobia, meaning fear of enclosed spaces, joins the Latin word element claustrum, which means enclosed space, to a Greek word element, which is phobia, which means fear. At first, medical terminology may seem daunting and overwhelming. However, after working knowledge of these word elements is gained, it becomes easier to analyze and use the words effectively. Medical terminology changes with the dynamics of evolving technology in healthcare. New terms, abbreviations, and words are constantly being created to meet the needs of the new technology. Through word association and memorization of basic medical terms and word elements, sterile processing technicians can establish a solid foundation upon which to build an extensive vocabulary. A sterile processing technician's vocabulary must be in constant state of growth, evolution, and development. Now, let's talk about prefixes, roots, and suffixes. So these are our word elements. And before we get started with talking about prefixes, roots, and suffixes, let's go over some of the terms, some of these definitions of these terms. So what is a word element? A word element is basically parts of a word. A root word element tells the primary meaning of a word. It is also called the base word element. Next, we have our prefix word element, which is the word element that comes before the root element. Next, we have our suffix word element, which is the word element that comes after the root word element. And then lastly, we have a combining vowel, which is typically an O that is sometimes used to ease the pronunciation of a medical word. All right, so the anatomy of a medical word will consist of these three word elements. First, we have our root word element. Again, your root word element will tell you the primary meaning of a medical term, which can then be modified by either a prefix, suffix, or both. Many roots signify a procedure, disease, or body part. For example, the term cardiology, the medical term for heart, features the root word cardio, conjunction with the suffix ology, referring to the study of the heart. The term endocarditis, some of these medical terms, don't make fun of me, don't say nothing in the comments. Endocarditis also features the root cardio, but in this example, the root is modified by a prefix of endo, meaning within, as well as a suffix itis, which means inflammation. So when the entire word is analyzed, the word means inflammation of the inner portion of the heart. The term cardiothoracic features two root words: cardio, meaning heart; thoracic, meaning chest. A cardiothoracic surgeon performs surgery on the heart, its major vessels, and the lungs. The term electrosurgery also features a combination of two roots. While the root electro refers to the use of electrical current, the root surgery refers to the act of performing surgery and the use of electrical current to cut and cauterize during surgery. All right, moving on to the prefix word element. Your prefix word element comes before the root. When added to a root at the beginning of a word, the prefix can alter or modify its meaning. For example, the medical term for the prefix around is peri. The term pericardial means around the heart. The term perioperative refers to the entire process surrounding the surgical procedure. Before, or perioperative; during, intraoperative; and after, postoperative. These prefixes, peri is also found in the surgical instrument periostal elevator, and an instrument used to remove tissue around the bone, the perosteum. Here, the prefix peri, around, is attached to the root osteo, or bone. Even the term abnormal functions in this way. The ab functions as a prefix to negate the meaning of the root, normal. The prefix ab means away from, meaning the word is away from normal or not normal. So that is how you get abnormal. Moving on to the suffix word element. Your suffix word element again comes after the root. When added to the root at the end of a word, the suffix can also alter or modify its meaning. For example, the medical term for the suffix that means inflammation is itis. The term pericarditis refers to the inflammation around the heart. The term tonsillitis refers to inflammation of the tonsils. Bronchitis refers to the inflammation of the bronchi, which are the tubes extending from the trachea into both sides of the lungs. When the suffix itis is found at the end of a medical term, it modifies the root word preceding it. It means inflammation is present. Of a special note, a combining vowel, which is typically an O, as we just learned, is either added to a root or removed from it to ease the pronunciation of a word. An easy way to remember the difference between a prefix, which comes before the root, and suffix, which comes after the root, is to put the words in alphabetical order. Prefix, root, and suffix. This tells you that the prefix is the first word element and suffix is the last word element. Not all medical terms will consist of 3 word elements. A medical term may be formed by a root alone, combining 2 roots, a root and a suffix, or a prefix and a root. Some medical terms can even be formed by combining 3 roots. Now, before I continue, I just want to let you guys know that the rest of this chapter is going to consist of medical terms. And I will go through some of them, but I will not go through all of these medical terms. It's like on pages. So if you are looking for a resource to learn medical terminology, like I said, I will go through some of them in this video. But I do want to state that I do have flashcards that include includes these medical terminology words. So if you are looking to study your medical terminology, I do have that available to you, and you can find that in the description box. You can also find it on my website, which is thesterileprocess.org. Now, also, I just want to reiterate, or I want to let you know that based on these documents right here, this is the exam outline. Medical terminology is not a large part of the exam. It is going to be about 10% of the exam, which is not a lot. You may get 1 or 2 questions about medical terminology, and it is part of customer relations if you want to confirm. This document is available on myhspa.org, and I definitely think that you should get this document if you are pursuing the certification, whether you are self-studying or taking a course. You want to be in charge of what you're learning, and you want to make sure and confirm that whatever you're learning matches this. This is what the exam is based on. I just want to let you guys know that. Getting back to the textbook. All right, so the best way to learn the meaning of a medical term is to analyze and understand its components so that the word can be taken apart. Begin with the suffix if present, since it is most often gives a clue of the meaning about the root and how it is being used. Then consider the root and prefix if present. In other words, consider the overall relationship between each word element in the term. Medical terms can be a lot like building blocks. If one can figure out how they fit together, one can determine what they mean. When analyzing medical terms, several suffixes meaning pertaining to may be encountered. Figure 2.3 provides a list of these suffixes, examples of common words, and the meaning of those words. So I'm going to read some of the medical terms from these charts. I'm not going to read all of them. So I'm going to read some common prefixes, roots, and suffixes that you may see when working in sterile processing. So the term hemi means half, arthro means joint, plasty means surgical restoration. When combining those 3 word elements, you get the term hemiarthroplasty. That means surgical restoration of half of a joint, the femoral portion of the hip joint, and the proximal femur. It is a form of hip replacement surgery. Next, let's do septorhinoplasty. Septo means dividing wall, rhino means nose, plasty is surgical restoration. When you combine those word elements, you get septorhinoplasty, which means surgical restoration of the nose. Here's another common one, and then we'll move on. We got col, which means bile, cyst, which is a fluid-filled sac, and then ectomy, which is the surgical removal of. When you combine those word elements, you get cholecystectomy, which means the surgical removal of the gallbladder. Now, as stated, I'm nosy, my bad. As stated, there are suffixes that mean pertaining to, so I'll go over those. So the suffix ending in AC, when combined with a medical term like cardi, and you get the term cardiac, that means pertaining to the heart. If you see a suffix that's AL or AL, when you combine with dermal, you get pertaining to the skin. When you get the term ick and combined with hemic, you get pertaining to the blood or pertaining to blood. If you see the suffix eel or EAL and you combine it with esophageal, that means pertaining to the esophagus. If you see the suffix ARY or ARY, and you can combine it with pulmonary, that means pertaining to the lungs. If you see the suffix us or OUS, and you combine it with cancerous, you get pertaining to cancer. Those are some common suffixes that mean pertaining to. There's some reading at the top of this page, so I'm going to make sure I read that. Making medical terms conform to the basic rules of spelling, punctuation may result in letters in the word element being changed, dropped, or added. Figure 2.4 shows examples. When analyzing a medical term, it is sometimes best to start with the suffix. In this way, one can readily identify if the word relates to a surgical procedure, a medical condition, or a portion of human anatomy. Figure 2.5 lists some common suffixes. So let's go over some of these common root suffixes, root and suffixes. So let's start with broncho. We learned a couple of minutes ago that broncho means bronchus. That is in your respiratory system. And when combined with the suffix itis, which means inflammation, you get bronchitis. And instead of us saying bronchitis, we drop the O and it becomes bronchitis. So dropping the O eases the pronunciation of saying that word. Let's do another one. Endo means within. Oscopy. Endo is a root word, which means within. Oscopy is a suffix that means visual examination. When you combine this root and suffix, you get the medical term endoscopy. The O is dropped because if not, endo already has an O. Oscopy has an O. So if you were to keep both O's, how would you pronounce that? Endoscopy? That doesn't sound right. So we drop the O to get endoscopy. Let's do one more. Let's do hister. Hister is a root word that means uterus. And then we have a suffix, pexi, which means fixation. When those two roots and suffixes are combined, you get hysteropexy. And in this situation, an O is added to ease the pronunciation. Because if not, it would be hysterpexy, which doesn't flow. So they added an O to ease the pronunciation. Now, let's go over some common suffixes and their meanings. So a common suffix that you may see, algia, which means pain. When combined with neuro, you get neuralgia, which means nerve pain. Another common suffix would be side, which means kill. When combined with bactericide, you get a substance that kills bacteria. Another common suffix that you may see is cis, or C-I-S-E. That means cut. When combined, you get the term excise, and that means to cut out. Another suffix, you will see this a lot, is ectomy. Ectomy means surgical removal. You can combine this term with this suffix with so many different examples, and I'll go through the examples. But number one, when you combine with cyst, you get cystectomy, which means removal of a cyst. When combined with the root word tonsil, you get tonsillectomy, which is removal of the tonsils. Another one would be laminectomy. You get removal of portion of the lamina, part of the vertebrae in the spine. If you combine ectomy with hyster, you get hysterectomy, which is removal of the uterus. When you combine ectomy with appendectomy, you get removal of the appendix. When you combine ectomy with thrombectomy, you get removal of a blood clot. If you combine ectomy with orchioectomy, you get removal of a testicle. If you combine ectomy with nephrectomy, you get removal of a kidney. So whenever you see the term ectomy, it basically means that they're removing something. Now, I will not go over all of these terms, but I urge you guys to purchase this textbook. It's $90 if you get it from myhspa.org. If you order it from anywhere else, they're gonna charge you an arm and a leg. Amazon is charging $125 for the textbook only. Amazon is charging, I believe, $135 for the workbook only. You can get both of these for $135 from HSPA's website. So I urge you guys to use the link that I have in the description box to get these textbooks. I don't have a discount code or a relationship with HSPA, so if you are concerned about whether or not I'm getting paid for telling you guys about the book, I am not. Okay, this is not an ad, but this is the textbook that you need if you are pursuing this certification, which is the CRCST certification, which is a Certified Registered Central Service Technician. Regardless, that is the textbook you're going to need. And so I'm just making it convenient for you so that you don't end up spending way more money than you have to. Now, let's get back to reading. Okay. Understanding usage. So learning medical terminology can be an almost endless process. As new surgical procedures are created, new medical terminology will also be created to refer to these procedures. Sterile processing technicians must understand the language spoken to them by the OR and the medical staff to provide them with the goods and services needed for their procedures. Language frequently used by the OR utilizes abbreviations, acronyms to refer to the various types of surgeries. Figure 2.8 contains a list of some surgical procedure acronyms and abbreviations. So I will go through some of the common abbreviations that you will see working in sterile processing. So some common abbreviations include AAA, which is the repair of an abdominal aortic aneurysm. The meaning of AAA is the surgical repair of a weakening or ballooning area of the abdominal portion of the aorta. Another one that you may commonly see depending on where you work, if they're doing a lot of cervical neuro, you'll see ACF, which is the anterior cervical fusion. I particularly work at a hospital that specializes in a lot of neuro and crani and orthopedic procedures, so I've seen a lot of these, and vascular as well. But an ACF is an anterior cervical fusion, which is the surgical fusion of vertebrae and the cervical spine approach from the side of the patient's body. Another one that you may see, especially if they're doing a lot of orthopedic procedures, you may see an AKA, which is above the knee amputation, which is a surgical removal of the leg above the knee. Another one that you may see is a BSO, if they're doing a lot of GYN procedures. A BSO is a bilateral salpingo-oophorectomy, which is the surgical removal of both fallopian tubes and ovaries. Another one that you may see if they're doing GYN procedures, an LAVH, which is a laparoscopic assisted vaginal hysterectomy. During this procedure, it is a visualization and treatment of pelvic organs followed by the removal of the uterus through the vagina. Another one that you may see if they're doing vascular procedures, mid-cab, which is a minimally invasive direct coronary artery bypass, which they use a small incision in the ribs, a mini thoracotomy, to access the heart to bypass diseased coronary arteries. Here's another one that you may see, ORIF, which is the open reduction internal fixation. This treatment of a fractured bone with an incision and the use of plates and screws or pins to hold the fragments together. Those are some common abbreviations and acronyms for surgical procedures. Moving on. The anatomy of a surgical procedure. Once sterile processing technicians understand medical terminology with the numerous prefixes, roots, and suffixes, they will be able to better understand the surgical procedures referred to in the surgery schedules and the instruments and supplies that will be requested. Challenges arise when the OR is supplied with the incorrect instrumentation and supplies for a surgical procedure. When the OR receives a case card for a scheduled procedure with the incorrect instrumentation and supplies, the surgical team's attention is diverted away from the patient and to getting the correct instruments in the room. That is why it is especially important for you to understand medical terminology so you can understand the OR when a request is made. When reading surgery schedules and interacting with the operating room staff, sterile processing technicians need to understand how procedure approach and purpose are identified. When a surgical procedure is referred to in a surgery schedule, the suffix attached to the primary medical term will indicate the purpose of the procedure. For example, if you see the term oscopy, that will refer to the visual examination of and possible treatment. If you see the word otomy, that will refer to the incision into. If you see the term ectomy, that will refer to the removal of. If you see the term plasty, that will refer to the repair or reconstruction of. Another key element in how a procedure can be understood relates to the approach the surgeon will use when performing the surgery. The approach or method typically comes from the beginning of the surgical procedure term. The following are some examples. Laparoscopic cholecystectomy will remove the patient's gallbladder using laparoscopic instrumentation. So we may have instrumentation that is specifically, we may have like cholecystectomy set. But if the surgery schedule is reading that this procedure is being performed laparoscopically, it'll say laparoscopic cholecystectomy. And that is a separate instrument tray. So you would have to find the set that says laparoscopic cholecystectomy. You cannot just give them the cholecystectomy set, because then that would be incorrect, and now you're causing patient care delays. Another example would include robotic-assisted prostatectomy, which will remove the patient's prostate by using robotic instrumentation and techniques. Another one is bilateral myringotomy, which will make an incision for drainage into the patient's tymphatic membrane or eardrum on both sides. Sterile processing technicians and the surgery schedule. So sterile processing technicians may be responsible for reading the OR schedule, to print pick list, obtain needed instrumentation, and find or obtain instrumentation that is already in use in another surgical procedure. Surgery schedules are prioritized according to the patient's needs. Figure 2.9 provides an example of a surgery schedule and terminology a sterile processing technician might encounter. In conclusion, knowledge of medical terminology is essential for ensuring that sterile processing technicians have a clear understanding of what the OR and other healthcare customers require for their procedures. Prefixes, roots, and suffixes are vital tools that will allow sterile processing technicians to communicate more proficiently. Now, I'll go over the surgery schedule. So you guys see that? Take a screenshot and then I'm gonna go over it with you. This is a sample of what the surgery schedule may look like. Some of these with you. So on the surgery schedule, it will have the room number where the procedure or which operating room they're gonna be using. So depending on how many operating rooms there are, it could be 1 through 20. According to this example, is 1 through 4. So the surgery schedule will have the room number, the start time, the patient's ID, the procedure, and then it'll have like comments on like what type of, maybe if there's some loaned instrumentation or some patient care equipment that is needed for that procedure. So the start time is obvious. It'll be whatever time it's gonna start. Now, if you see the abbreviation TF, that means it's to follow. I believe that's what it means. Let me know in the comments, you guys, if you're currently working as a sterile processing technician and I'm incorrect, I don't mind being corrected. If I'm incorrect, let me know. Do it with kindness though, that's all I request. I believe that TF means to follow. Then it'll have the patient's ID and then it'll have the procedure. Based on the procedure name is how you're gonna pick the instruments. Now, if you're working somewhere where they take the guesswork out of it and you don't have to figure out what instruments are needed, great. But that is especially why it's important to understand medical terminology. All right, so that wraps up chapter 2, medical terminology for sterile processing technicians. Like I stated in the beginning, you guys, answer the learning objectives. And so let's test your knowledge. Based on what we just read, can you explain the importance of medical terminology for sterile processing technicians? If you're able to do that, type it in the comments. Identify the various elements used in medical terminology, including prefixes, roots, and suffixes. In the comments, let me know what each of those word elements mean. Number 3, discuss how medical terminology can refer to human anatomy, disease processes, surgical instruments, and surgical procedures. Let me know in the comments. Number 4, understand medical terminology used in reference to surgical procedures and surgery schedules. Let me know in the comments. And lastly, but not least, understand the importance of medical terminology for service quality in the operating room. So, do you understand why is it important for us to have a good grasp and understanding of medical terminology to assist the operating room and the other departments that we service? If you can answer these questions, then you have a good understanding of chapter 2 and you should move on. You can move on to chapter 3. Let me know in the comments if answer these questions and we can go over them together. I will see you guys next week. So my goal is to have chapter 3 available. My goal is to have it available Monday. That's my goal. I don't want to say I promise, but that is my goal. I'll have it available soon, you guys. So make sure you like, comment, subscribe. All right, see you guys later. Bye.